I want to introduce you to another paramedic that we've invited onto the program. His name is Clive Derbyshire. And Clive, first of all, thanks for being here.
Thank you.
You're a primary care paramedic. And you have a bit of a unique perspective on all of this because you are a working paramedic. You were working today and also responding to calls yesterday in the downtown east side. You've also struggled with addiction.
I have, yeah.
Can you tell me a little bit about that?
I've been an alcoholic most of my life. Started drinking at the age of 13 and it progressed. University, used cocaine off and on. And about 2 years ago, a little over 2 years ago, I became addicted to crystal methamphetamine.
How bad did it get for you?
At the end of my addiction, I was essentially homeless, and I was an IV user.
You've overdosed?
Not so much in the type that you'd overdose on like a opioid overdose, but I have been in, I have overdosed technically, I guess, on crystal meth, yeah.
So what turned things around for you? Because you say as recently as 2 years ago, you were on crystal meth.
Yeah. My life became incredibly unmanageable. I was, like I said, I was kind of backed into a corner, or at least I felt I was backed into a corner. I had run out of people to lie to, cheat to, minimize, or to take away from. I felt that I needed to, and I felt that I was on the edge of dying. I was in huge amounts of depression. I had huge amounts of social anxiety. Lost confidence in everything that I had in my life. My daughter was afraid to be around me. My family was lost trying to get their brother and their son back. And my friends started leaving me, started leaving my life. And it was at that time where I knew that if I continued on using the way I was using, I was either going to kill myself through suicide or by overdosing on stimulants.
In your mind and in your heart, you had made that conscious decision that something needed to change, but often that's not enough. Treatment-wise, what worked for you?
I reached out to my employer, BC Ambulance Service, and told them what was happening. I was already being seen by their psychologist for PTSD, and for myself, it was recommended that I went to and attended a residential treatment program, which lasted for two months. I returned to Vancouver from Guelph, and I remained clean for 4 months. And at about 4 months, I relapsed with crystal methamphetamine again, and went back to my employer, told them what had happened, thinking that I was probably going to lose my job, but that was far from the case. They were incredibly supportive of my relapse, and I received more help. I was admitted to the Alliance program at Together We Can here in Vancouver, another men's residential treatment program. And I was discharged from that program on 4th of June.
Wow.
As a residential treatment. And I currently live in a what's called a second stage treatment house, which is just a sober living environment with people that I went to treatment with, and where you hold each other accountable. And yeah.
And you work, as I said earlier, as a paramedic. You've responded to overdose calls in the downtown east side. Has your experience with addiction, has that changed the way you do that job?
Yeah, I would certainly say so. I have a huge amount of empathy for patients in the downtown east side, for patients anywhere that overdose and have addiction issues. I can relate to their powerlessness over their addiction. I can relate to wanting to get out, wanting to get help, being afraid of the stigma of addiction, being afraid of or being ashamed of addiction, holding my family hostage, so to speak. You know, I can relate to all of those things, and I'm able to give them a very non-judgmental, empathetic, compassionate approach to treatment, or to treatment of the situation, and it gets hard even for me though.
You think that kind of empathy is in short supply these days?
I think, you know, there are all kinds of things that break down someone that does my line of work, and one of them is I think they call it compassion fatigue now, and especially with something that has such a stigma of addiction, where people either choose to you know, minimize what addiction is, and it's just a choice, and it's not a choice. At the stage of these chronic users, it's not a choice. It wasn't a choice for me at the end of my addiction. It was a choice when I started.
I asked Bronwyn this question, and I want to ask you the same question. Do you see light at the end of the tunnel?
I see hope. I see a glimmer of hope in everybody's eyes. And I need to see that hope. I chose to work in the downtown east side as a paramedic because I can relate to a vast majority of the patients, whether it's in an overdose situation or not. I'm in a position to have a unique perspective on addiction, both being somebody to treat somebody and to help myself. And being reminded of where I was at in my life and where I am today is able to give me the power to give back to help other addicts.
Clive, thanks for sharing with us.
Thank you.